Mr. President, you and I are here today, and we've been meeting today in Washington at really a groundbreaking moment as we continue this battle for our health, for our economy, and against the virus. And what makes this such a critical moment is the developments we've seen in the last 10 days regarding a vaccine. You know, public health experts around the world have agreed almost from day one that the way to really find the end of this pandemic, the ultimate weapon, would be a vaccine, and a vaccine that worked. And less than a year ago, in January and February of this year, we were hearing that 2 years would set a record to develop a vaccine, that sometimes a vaccine developed on a new disease like this has taken 3 and 5 and even 10 years or more. And here we are, less than a year from the discovery of COVID-19, with not just one vaccine, but 2 vaccines that have already applied for their use permit, both of which have shown effectiveness of more than 90%, and a third vaccine with similar responses about to come to the place that they too can apply for use. These are incredible numbers. It hasn't been that many months ago that healthcare experts were saying if we get a vaccine that was effective 50% of the time or more, that the government should consider accepting that vaccine and making it available to people. But here we are at a 90% effective vaccine. You know, I think I had the measles, my kids had the measles shot, which seemed to pretty much eliminate measles. That was 90% effective. This is the kind of vaccine that's been the most effective, among the most effective vaccines we've ever had. Pfizer and Moderna have both come forward and asked for their emergency use authorization. And Mr. President, you know, the emergency use doesn't really mean that they've cut any corners. The only thing we failed to do is watch the 30,000 or so people that were in both of these trials for another 2 or 3 years. That's why we can't say with certainty that this vaccine will last for a lifetime, or this vaccine is a 3-year vaccine or even a 1-year vaccine. What we can say with certainty is that about 95% of the time, it prevents you from getting the disease. And of course, if people are prevented from getting the disease, they can't spread the disease, and that's why a 90% effective vaccine like the measles vaccine was basically 100% effective as long as people were taking it. So we need to step back really, I think, and look at the unconventional way we got here. How did we get from 3 to 5 to maybe 10 years to less than a year from discovering a virus for the very first time to having a vaccine? The way that researchers have been able to move forward with this, the way that Congress and the Trump administration have responded to this pandemic has been extraordinary. In our country, Operation Warp Speed accelerated the development of this new vaccine through a fast-track process that could be described really in one word: unprecedented. Normally, vaccines that would take years, researchers have to go out and secure funding, they have to get approvals, they have to study results step by step to get to where we are today. Only then would a vaccine be determined safe and effective, and only then does manufacturing begin. Normally with the vaccine, the day the vaccine is approved is the day you start manufacturing. We know that's not what's happening here. In fact, I'm going to mention in just a few minutes that the head of distribution says the day the vaccine is approved, we'll start shipping millions of copies of that vaccine all over the country. This all really started with Congress deciding, as we put these packages together, the COVID relief packages together, from the very first couple of packages, when it came to a cure, we weren't going to let funding stand in the way, nor were we going to let it stand in the way that we might invest some money somewhere that it just simply doesn't work, because by investing money where it didn't work, it allowed us to invest money where it did work. The Congress appropriated $18 billion for vaccines and testing. About $12.5 billion of those dollars have gone into the vaccine side. Most of the rest have gone into testing, with some going into therapy. But this is a decision Congress made. We're going to become partners in developing how we fight back to this vaccine. There was a risk that some of the vaccine candidates we supported wouldn't make it, but there was never a risk that the vaccine candidates that did make it wouldn't be as safe as any vaccines have ever been. In fact, many of these vaccines have had more people involved in the study than ever before. Because of the virulence of the virus, they were, frankly, the people in the studies were more likely than not to be exposed to COVID, and a bunch of them were more likely than not to catch it. And of course, that's the moment when you decide, was the group that caught the virus, was the group that had the virus, were they the group that had the vaccine in these studies, or they the group that didn't have the vaccine? And what we found out was 95% of the time, they were the group that didn't have the vaccine, which is where you get that 95% number. Congress provided that we would take some risk. We always hear, we so often hear that failure is not an option. In this case, if you didn't fail, you weren't trying hard enough. If you didn't invest in, when you're looking, okay, which of these are more likely than not to be approved, if all you wound up with were things that got approved, you probably left some things on the table that you should have tried. You're a great businessman, Mr. President, and if you're in a business that's growing, you're going to have some failures. If you never have failures in your business, you didn't try anything new, which meant you probably didn't grow. So we'd have failures not in a vaccine that will get to people, but thinking this appears like it's got a good chance of being approved. Let's put it in the group of vaccines that we're working on. President Trump, in warp speed, stepped up and decided they were going to move at a faster pace than ever before, but with more safety than we've had in most vaccine developments in the history of the country. So we decided to support several vaccines that, again, we thought had a better chance of being approved than not. Now, you take some risk in that, because all the vaccines won't be approved, but you take no risk that you're going to support a vaccine that's approved that's not safe. That's not what happened at all. You just put a lot of horses in the race. The dean of the National School of Tropical Medicine at Baylor University says, if you're racing to get a vaccine quickly, one way to do that is put as many horses in the race as you can, and that's exactly what we've done. We've invested in several potential vaccines, and I think 3 different paths to a vaccine, which means that all the vaccines that are approved will not be exactly the same in how you have to store them, how you have to transport them, whether you have to have 1 shot or 2 to have the full vaccine. And we've signed contracts with 6 leading candidates already. We've invested $2.5 billion to help develop and purchase 100 million doses of the vaccine being developed by Moderna. That was jointly developed by the National Institute of Allergy and Infectious Diseases and the company. We've dedicated $2 billion in a different pattern to purchase 100 million doses of the Pfizer vaccine. And we've done that with that investment in a way that allows us to shorten the processing time, combining various study phases and clinical trials going on at the same time, and moving forward in a way that also allowed us to be manufacturing vaccines while we were still studying and moving toward final approval by the FDA. So we've got 2 vaccines standing in ready now for final approval. Another one to join them soon, another one to join them quickly after that. But all of them are already in the stage of manufacturing. So, Mr. President, what's the worst thing that could have happened to taxpayers? We invest in a vaccine that turns out not to work, and at that point, we step in, meet our commitment, in essence, buy the vaccine that didn't work, be sure that it's effectively destroyed, and realize that that was a risk, that was a chance we took that didn't produce a result. But the other vaccines that did work had a result and had vaccine available as soon as they were approved. In fact, General Perna, the Operation Warp Speed's chief operating officer, said the government would begin vaccinations within 24 hours after a vaccine secures FDA approval. In the past, I'd say you'd be closer to saying it'll be 12 or 24 months after approval before the first vaccine is ready to go to the first person. But now we're saying 24 hours, and we are on the edge of that 24 hours. I talked today with the governor of my state, the governor of Missouri, Mike Parson, and the head of the Department of Health and Senior Services, Dr. Randall Williams, about what they were doing. They submitted a plan early. I was with the governor in, I think it was mid-August, when the Center for Disease Control told all the governors, we want to have a plan by the end of October of how you're going to distribute this vaccine when you get it. I said about that same time, if we failed in our effort to get the vaccine effectively distributed after the effort we've made to get it, it would be one of the great government failures of all time. But Governor Parson, Dr. Williams, others who have worked hard on this in our state, put a plan in, put it in pretty early, and now are ready to execute that plan as soon as they have the vaccine available to. About 2% of the population of the country lives in Missouri, and so about 2% of every distribution will go to Missouri as vaccines are ready. I think roughly Pfizer will have about 25 million vaccines to distribute almost immediately. Moderna will have about 20 million to distribute almost immediately. And we know that others are standing right behind them. Another thing that Congress asked the Center for Disease Control to do was come up with a recommendation on how the vaccine, who the vaccine should be given to. And just this week, the CDC Advisory Committee made their recommendation to the Center for Disease Control either today or sometime soon after today. The CDC, all likelihood, will adopt those recommendations as they had in the past. And the recommendations go something like this. First, you want to prioritize healthcare workers and people most likely to have the worst result if they catch the vaccine. And so if you take all the healthcare workers in America and all the people in a senior living kind of condition in America, you're talking about around 15% of the population. Somewhere in there, either in that group or the next group, you include all the first responders and police officers in the country that come into situations so often that they have no control over, and then you go to the other essential employees in America. The child care center worker, the school teacher, the bus driver, the grocery store clerk, the food processing person that's out there making this happen. I think there's been some decision made on the healthcare workers that we should include clergy in the healthcare workers because they're so often present in hospitals and with people in circumstances where they would like to see someone from their faith present, but that person also is a healthcare provider in the healthcare network, just like others working in the hospital can be able to get that early vaccination. But let's go back to the essential workforce. The essential workforce of the groups we've talked about and others that come into lots of contact with people, often least able to make arrangements in their own time to even get a vaccine if it's for free, they're going to be a big priority. And when I go to the grocery store and I walk by, I ask someone for help, which I often need to do to find the one thing on my list I don't know how to find. Or when I go by to check out with the grocery store clerk, if the grocery store clerk, no matter how big the shield is between them and me, if they couldn't possibly get it from the person that checked out 2 days earlier or earlier that day, they can't possibly give it to me. And so every step of the way, the whole country becomes safer until hopefully by the end of April or so, we're at a place where everybody has access to the vaccine. By the way, by the time you do the 15% of the population that is most likely to have a bad result if they get the vaccine, and healthcare workers, and add that to the 35% of the population that's the essential workforce, that's 50% of the population that could have had the vaccine if they chose to have it. And I think most people think we're there in our state and other places by sometime in April. In fact, Dr. Fauci said that Americans determined to be at the highest risk, healthcare workers, frontline workers, seniors, those with underlying conditions, could be vaccinated by the end of the year. Certainly, if there's a second shot involved, it might be by the end of January. But you get 15% of the whole population vaccinated by the end of January or sometime in January, and another 35% would have vaccine available to them by sometime in April. And then we look, Mr. President, at the rest of the population, but in each step of the way, let me say again, every time you take somebody off the playing field where contact with the virus could successfully occur, everybody else gets safer too. If a person who's been vaccinated is where the germs happen to land instead of the person standing beside them that weren't vaccinated, that life of that particular germ is gone. And eventually, that's how you emerge from a pandemic. There aren't enough people left for this to land on that either haven't had it or haven't had the vaccine to prevent it. It's a critical time, it's an important time. I think we've written 2 new chapters in pandemic response, both in testing and in vaccines. Operation Warp Speed has done in months what typically can take 10 to 15 years, and even in an expedited way can take 2 to 3 to 5 years. Given the urgent need to beat this virus, I think Operation Warp Speed with the great scientific community, a lot of this is built on research that was funded by NIH. One of the priorities of the Congress for the last 5 years had been to increase NIH funding at a time when we know more about genetics, about 2 of these vaccines are basically based on the molecular code that is sort of the software for genetics. It's a different way than vaccines have been developed before and would not have been developed without government-encouraged research. Having a diverse selection of vaccines, one, means there are more different people producing vaccines at the same time in different places, and we'll have a more likely quick and fair distribution of any FDA-authorized vaccines. Certainly, I've been frustrated, as many of us have, to think that we've not been able to reach an agreement on what money we might need to finish this vaccine effort, the distribution effort. Hopefully, we can come to the next round of COVID relief sooner rather than later. As I said earlier this week, a targeted funding package now will have a lot more impact than a much bigger package would have 4 or 5 months from now. There's no reason we shouldn't be able to find common ground. This is a time when we can make that effort to finish the job. The pandemic is affecting Americans every day. I've talked to a lot of people who have seen greater moments of drug dependency, huge declines in mental health because that support network is gone and the isolation has taken over, or worry about family, finances, health have become a big part of that. Let's show the people we work for that we're going to be able to continue this job. And let's praise the great researchers in our country, others who stepped forward in incredible ways to do things that just 9 months ago nobody thought could possibly be accomplished in the time frame we're working on right now.